Around ninth or 10th grade, I kind of developed a affinity for biology and anatomy class and things like that, and I kind of had an idea at that time that I wanted to be a doctor. I went to medical school at Harvard Medical School and was in a joint program with MIT and Harvard. Your fourth year, you enter a match program, and I happened to match here at Washington University in St. Louis as a resident. So I came here in 1988 as an intern. St. Louis has been a great town for me and my family. Met my wife here when I was a resident, and we've raised 5 children. As the early years went by, developed a clinical experience in surgical treatment of obesity and really saw the dramatic improvements in the quality of life that patients had who underwent surgery of that type. During my tenure here, one of the things I think kind of most proud of is the development of Barnes-Jewish Hospital as a center of excellence in bariatric surgery. Those folks who are going to need intensive care unit post-operatively or have very special needs, maybe they have a transplant and they're morbidly obese having surgery, those patients are going to get operated on at Barnes-Jewish Hospital, our main flagship site. But for the more than half the patients are what I would consider low to moderate risk bariatric surgical patients. They have their choice of having surgery either at Barnes-Jewish Hospital or at Barnes-West County. And the Barnes-Jewish West County Hospital experience is a little bit different. It's a smaller hospital. It's more of a suburban setting. You can park within 100 feet of the door. So those things are very nice for patients and their families. They really do enjoy that kind of experience of a smaller facility. And again, we've been providing bariatric surgical services there for 14 years. And so the people out there are also very experienced and can handle the bariatric patients there as well. In bariatric surgery, one of the things that is almost always true is that the patient is coming to you with a major health problem, that is severe degrees of obesity. They just have struggled with their weight for many, many years, and it's getting the best of them. They're starting to get diabetes, they're starting to get high blood pressure, sleep apnea. And so you're taking somebody like that and then going to put them under the knife for 1 to 2.5 hours, and there's risks involved in doing that. And so you have to help them balance what are the potential upfront short-term risks for having surgery in order for them to have the longer-term benefits. And the data indicate that patients who have bariatric surgery live longer if they have the surgery. They're going to have less chance of having a heart attack, less chance of having a stroke, actually less chance of getting various forms of cancer as well. So it's really, health-wise, a no-brainer in a sense that they should have surgery if they're starting off that severely obese. They're able to play with their grandchildren, they're able to run around in the yard and not be too tired and out of breath. They're able to mow the grass themselves where they never could do that before. I get to see the results of these operations on a daily basis. I get to talk with patients who have had these life-changing alterations in their health. And so it's very gratifying for me to come to work every day and get to see patients who have had surgery. Sometimes I meet them in the hallway. Oftentimes you don't recognize them after they've lost as much weight as they have, but they always will come up to me and tell me a little bit about their story, and that's a very gratifying thing about my job.